Less medicine, more health? What research says about avoiding unnecessary medical care? Less medicine, more health? What research says about avoiding unnecessary medical care? Can more medical tests and treatments actually make you less healthy? For decades, many people have believed that more testing, more scans, more medications, and more procedures automatically lead to better health. However, a growing body of medical research suggests that more healthcare is not always better healthcare. Dr. H. Gilbert Welch, Professor of Medicine at Dartmouth Medical School and an internationally recognized researcher in medical screening and overdiagnosis, argues that unnecessary medical care can sometimes expose patients to risks without improving outcomes. The goal is not to avoid medical care, it is to receive the right care at the right time. What is overtreatment? Overtreatment occurs when patients receive medical tests or treatments that are unlikely to improve their health but may increase costs, anxiety, side effects, or complications. Examples include unnecessary imaging studies, routine screening in low-risk individuals, antibiotics for viral infections, surgery that offers little additional benefit, long-term medication without clear indication. Research published in JAMA Internal Medicine, the BMJ, and the New England Journal of Medicine has consistently shown that overdiagnosis and overtreatment are significant healthcare concerns worldwide. 1. Not every risk can be eliminated. Everyone has some risk of developing disease. Modern medicine can reduce many risks, but no treatment can reduce risk to zero. Studies have shown that aggressively treating every possible risk factor often produces only small improvements while increasing medication side effects and healthcare costs. Research highlights. The US Preventive Services Task Force emphasizes balancing the benefits and harms of preventive care. The Cochrane collaboration has reported that many preventive interventions provide modest benefits, but may also produce unnecessary treatment in low-risk individuals. The takeaway. Healthy habits, including exercise, proper nutrition, quality sleep, stress management, and smoking cessation, often provide greater long-term health benefits than excessive medical intervention. 2. Not every abnormal finding needs to be fixed. Modern MRI, CT, and ultrasound technology can detect extremely small abnormalities. Many of these findings never become painful or dangerous. Research shows. Studies published in the New England Journal of Medicine found that many healthy adults have spinal disc bulges, disc protrusions, rotator cuff tears, meniscus tears, and other imaging abnormalities, despite having no pain. Examples include lumbar disc bulges, cervical disc degeneration, shoulder tendon tears, knee meniscus tears. Treating every abnormal MRI can lead to unnecessary surgery and prolonged recovery. The patient, not the image, should guide treatment decisions. 3. Earlier detection is not always better. Early diagnosis saves lives in many situations. However, early detection can also identify diseases that would never become harmful. This is called overdiagnosis. Research evidence. Major studies involving prostate cancer, thyroid cancer, breast cancer, and lung cancer have demonstrated that increased screening can increase diagnosis rates without producing equivalent reductions in mortality. Researchers estimate that a significant percentage of certain cancers detected through screening may never have caused symptoms during a person's lifetime. This is why many screening guidelines now recommend individualized decision-making rather than universal screening. 4. More testing does not always mean better care. Many imaging studies reveal incidental findings, sometimes called incidentalomas. These unexpected findings often trigger more imaging, specialist referrals, biopsies, surgical procedures, anxiety. Research published in JAMA estimates that incidental findings occur in a substantial proportion of CT and MRI examinations, many of which are ultimately benign. Sometimes the test itself creates a cascade of unnecessary medical care. 5. Sometimes the best treatment is conservative care. Not every condition requires immediate surgery or medication. Evidence-based conservative treatment may include chiropractic care, physical therapy, exercise therapy, manual therapy, activity modification, weight management, education. Clinical practice guidelines from the American College of Physicians recommend non-drug therapies as the initial treatment for many cases of acute and chronic low back pain. Many musculoskeletal injuries improve naturally with appropriate conservative care. 6. Newer is not always better. New technology is exciting, but new does not automatically mean better. Some medications and procedures appear promising initially, but later reveal previously unknown complications after widespread use. Medical history contains many examples where treatments once considered breakthroughs were later modified or withdrawn because long-term risks became apparent. Evidence, not marketing, should guide healthcare decisions. 7. Health is about more than living longer. The ultimate goal of healthcare is not simply avoiding death. True health includes living without pain, sleeping well, moving comfortably, working productively, spending time with family, remaining independent, enjoying hobbies, maintaining emotional well-being. A treatment that slightly reduces disease risk but greatly decreases quality of life may not always be the best choice. Healthcare decisions should reflect each patient's goals and values. What does this mean for chiropractic patients? At Soft Touch Chiropractic, we believe patients deserve thoughtful, evidence-informed care. Many musculoskeletal conditions improve with conservative treatment before invasive procedures become necessary. Chiropractic care focuses on restoring joint mobility, improving spinal function, reducing muscle tension, enhancing movement, supporting natural healing, helping patients return to daily activities. Conservative care is recommended by numerous evidence-based guidelines as an appropriate first-line treatment for many spine-related conditions. Questions to ask before agreeing to any test or procedure. Before proceeding with imaging, medication, injections, or surgery, consider asking your healthcare provider, what problem are we trying to diagnose? How will this test change my treatment? What are the risks? What happens if we wait? Are there conservative treatment options first? What does the scientific evidence recommend? Being informed helps patients make better healthcare decisions. The bottom line: medicine has transformed countless lives. Emergency care, trauma care, vaccines, antibiotics, and many surgeries save lives every day. At the same time, decades of research show that more testing and more treatment do not automatically produce better outcomes. The best healthcare is personalized, evidence-based, and focused on providing the right treatment for the right patient at the right time. When appropriate, conservative care can help patients recover while avoiding unnecessary risks and procedures. Looking for conservative care for neck pain, back pain, or auto accident injuries? If you are experiencing neck pain, back pain, headaches, whiplash, or joint pain, our team at Soft Touch Chiropractic provides comprehensive evaluations and evidence-based conservative treatment plans tailored to your condition. We focus on helping patients reduce pain, restore movement, and improve function before more invasive options are considered when appropriate. Call Soft Touch Chiropractic today at 818-831-0100 to schedule your evaluation and learn whether conservative chiropractic care may be the right first step for your recovery. References: Welch H.G. Less medicine, more health. 7 assumptions that drive too much medical care. Welch H.G. Schwartz L.M. Woloshin S. Overdiagnosed, making people sick in the pursuit of health. Chu R. et al. American College of Physicians Clinical Practice Guideline for Non-Invasive Treatments for Acute, Subacute, and Chronic Low Back Pain. Annals of Internal Medicine. Brinjikji W. et al. MRI. Findings of disc degeneration in asymptomatic individuals. American Journal of Neuroradiology. Bowden S.D. et al. Abnormal magnetic resonance scans of the lumbar spine in asymptomatic subjects. New England Journal of Medicine. Deo R.A. Cascade Effects of Medical Imaging. JAMA Internal Medicine. U.S. Preventive Services Task Force. Recommendations on Preventive Screening and Shared Decision-Making. Cochrane Collaboration. Reviews on preventive care, screening, and evidence-based interventions.